Why does experience of the physician and the laboratory matter in creating your miracle? Let's talk about it. So the experience of the physician, of course, is very important. I highly recommend you choose a physician who is double board certified in both obstetrics and gynecology and reproductive endocrinology. And I would recommend that you talk to the doctor to see how many cases they've had. How many gestational carrier cases do they do a year? I will tell you that doing the procedure of the egg retrieval and the procedure of the embryo transfer is pretty straightforward, but managing cycles, managing egg donor cycles, managing gestational carrier cycles definitely takes a lot of expertise. And this is where the art of the science comes in. So that sort of expertise is, of course, what you are looking for when you are investing so much time, finances, and heart into emotional energy into creating a family. And in terms of a laboratory, expertise really matters. Of course, the state-of-the-art technology is really important to have the best chances of success. You definitely want to be at what I would call a bigger clinic with lots of resources to get the latest technology. You also want to be at a clinic with experienced embryologists. So these are embryologists who are doing lots of cases. I definitely would recommend that you choose a clinic who does thousands of cases a year compared to tens or hundreds. Maybe not necessarily thousands of gestational carrier cases, but thousands of IVF cycles. You want people who are really good at injecting sperm into an egg. You want people who are really good at biopsying embryos for genetic testing, who are really good at freezing embryos and allowing them to survive that thaw. And that type of expertise happens from experience. And if you have an embryologist who's doing a biopsy in an embryo once a week, that's certainly different than a clinic who's biopsying 50 embryos a day. And certainly when you think about clinics with high volumes, you obviously don't want to get lost in the crowd, but those scientists who have very delicate jobs of very delicate, specific roles in terms of the procedures they're doing on eggs and embryos, their experience and their ability to do their job to help create those embryos that are healthy and successful really matter. So I definitely would ask the clinic about sort of how many cases they're doing. I think volume is a good question to be asking, sort of how many cases they're doing and the experience they have in terms of genetic testing on embryos, if they're doing egg freezing, embryo freezing, that kind of thing. So obviously part of it is sort of a gut, but this is why it's really important to choose the right clinic to have your miracle.